Okay, good afternoon, everybody. I'm Adam Crawford. I'm the co-director of the ESRC Vulnerability and Policing Futures Research Centre, and it's my great pleasure to introduce today's webinar. Today is the third in our series of webinars that we've been running over the last few months, and will continue to do so into the new year. Which are drawing on and showcasing some of the findings of the projects that have come to completion under the auspice of the ESRC Vulnerability and Policing Futures Research Centre. Can we move to the next slide, please? So I'm just going to take up very little bit of time while people join us, just to say that please do keep connected with the ESRC Centre. There are some particular opportunities that are ongoing that we would like to just highlight. First of all, we have our translational fellowship schemes, which is primarily aimed at practitioners with interesting projects aligned to our agenda around vulnerability and policing, who have ideas of work that they will do. We can support that work both through mentorship and also through some funding. So do get in touch via the website, but that's aimed at the practitioner community. Secondly, we have our PhD network, and we host a number of events and are planning a summer school for next year. So the PhD researchers amongst the audience, please do avail yourself of that. And then thirdly, we currently have open our third round of our early career researcher development fund, which is funding to support early career researchers based at an institution in the UK to do research with partners that again links to the broad theme. There's an open call, but there are some, each year we have a thematic steer, so do look at that. This year's is more methodological in terms of the steer rather than in terms of particular areas of substantive work. Next slide. So just to say that the research as it completes, we publish summary findings on our website, and you can access, including the summary findings in relation to this project, which have been available for a while. Do take a look at those, but that draws all the research from across the many projects that the ESRC Centre is supporting and are part of its program. Next slide. Great. So do stay connected with us. There will be more information on the next webinar in early in the new year. You can register for or subscribe to our newsletter. Keep in touch with us via the website or via our social media, and you have the details there by which to do so. Before I introduce the team, just to say by way of how this is going to be run, the team will present the findings from the research. We will leave about 15 minutes at the end for questions and answer. Please do put questions as we go along in the Q&A function, not in the chat. We can communicate to you via the chat function, but for you to ask questions, I will then relay those questions to the team in the discussion point, but also the team can answer via the Q&A function as well as we get into that stage. Okay, so it leaves me no further ado than to introduce the team and who are going to talk to the title of Offline Responses to Online Problems, Co-Designing Community Response to Online Child Sexual Victimisation. And it's my pleasure to hand over to Professor Corinne May-Chahal, who's leading the team based at the University of Lancaster. Corinne, over to you. You got your mute on, Corinne.
There's always one, sorry. To start off with, we're going to talk about a little bit around the context of this project, because the whole idea underpinning this is to look at how resources for law enforcement can be perhaps better distributed to deal with this quite big problem. Then Larissa and Christine are going to run through what we actually did and some of the findings. And then we're going to have a quick discussion about where we go from here. And then, as Adam said, opportunity for questions and answers. Next slide. So this is a big problem globally. There's a centre called the National Centre for Exploited and Missing Children, currently often known as NCMEC, in Washington. And that centre records globally the reports that come from social media companies and users of social media. Last year, they had a 19% increase in the numbers of files that were reported to them. 35 million reports were made to NCMEC up to in 2022-23. And of those, there were 104 million files behind those reports, half of which roughly were images and half of which roughly were videos of child sexual abuse material. So this is a mega problem. And basically, okay, we can say that's in the States, but actually it comes from all over the world. And over 90% of those reports were resolved, as NCMEC put it, by returning them to the countries from which they originated. So that means that organisations like the National Crime Agency in the UK will get reports from NCMEC, and this is the same across the world. And basically, they then leave it to those countries to decide on what they do with those reports. In terms of offenders, Childlight, which is an observatory running out of Edinburgh University, which looks at authoritative sources of evidence and comes to a reasonable kind of estimate of prevalence, found that 11% of men in the United States, 7% of men in the UK, and 7.5% of men in Australia are involved in online child sexual abuse offending. And these are likely to be obviously underestimates, because then these figures need people who report them. But the estimate around prevalence for children is that 1 in 8 children globally have been subjected to online solicitation in the last 12 months. Now, that figure is probably about accurate also for the UK. The fastest growing age group appearing in child sexual abuse media is younger children under 10. And this is partly due to the way in which these forums work in online, particularly in what's known as the dark web, where to join forums, one has to have increasingly severe and increasingly original media. And that means actually going for younger children. So this is a really big problem for the police, because law enforcement across the world are absolutely besieged by these images, this media that's coming through to them. And yet it's growing every year. So it's not something that we're tackling very well. We probably need to look at our resources better. And so this project is focused specifically on the offline world as a consequence. If we just go to the next slide. So in terms of prevention, the World Health Organization in 2002 published a major report on public health approaches to violence, and part of that was around child abuse, child sexual abuse. And the public health approach basically says that there are 3 levels of prevention. Primary prevention, which is universal. And in this field, that means children's awareness and education, mainly delivered through schools, which every evaluation has found has limited impact. Whilst children understand the messages and listen to the messages, they actually don't change their behaviours when it comes to the online practices. And there is a very limited focus on parents and actors outside of school. So the focus is all on the child, but not on the parents or those that perhaps need to be part of their protection. At a secondary level, which is generally seen as a more targeted approach, this is largely aimed at perpetrators, which is obviously important, but screening, which would be another approach which could be applied in this area, as it has been for other areas of violence, such as domestic abuse, that is very partial, mainly in the US. And basically, people do not want to talk about it. So teachers lack confidence. It's really difficult to raise this issue and have a screening program that perhaps even parents would agree to. So tertiary prevention is the main area of prevention at the moment, and that's really in different guises. So one of them is the multi-agency safeguarding arrangements and working together, which is the guidelines for safeguarding in the UK, mention the online all the way through, but they don't actually, there's no clear guidance specifically for online harms. Multi-agency safeguarding arrangements depend on reporting. And so children have to report, or parents have to report, before anything is done about it. And as we know from all the surveys that are done, this issue is underreported. And there's lots of things that the project has turned up around that issue, which Larissa and Christine will cover. A second way in which tertiary prevention works is through automated tools for child sexual abuse media detection online. And these are generally used by the police and by electronic service providers to varying effect. Some of them are more efficient than others, but they are getting, with deep learning and new approaches, they are getting more and more effective. But of course, they're more and more effective at finding the media. And then you get this problem that I began with at NetMech, which has 35 million reports and over 100 million images in 1 year. Digital health interventions for victims. So tertiary prevention is all about stopping this happening again and dealing with the consequences for victims. They have potential, but existing online safety resources often don't reflect the reality of online dynamics. And professionals feel ill-equipped to deal with this fast-changing field. The issue here is things change rapidly. So new games, new opportunities. We're now just seeing the advent of AI-generated CSAM and so on. There's a whole range of issues in there that constantly change. So how do we keep up? Okay, next slide. So another approach that's taken in terms of prevention is changing the law. And this is in some ways quite popular because the public thinks something should be done about it. And we have changes in legislation, new acts, new bills across the world. Here's just a sample of those. Australia's Online Safety Act, Singapore, Sri Lanka, and so on. They're all across the world. There are attempts to change legislation to deal with the problem. Now, the problem is, of course, that legislation is limited in terms of what it can do. The UK Online Safety Act, as it is now, is really not going to change very much on the ground. It is designed to tackle tech companies, electronic service providers, and it asks them to do risk assessments, to find content on their sites, to report that and take it down. Now, two things about that. Firstly, as I've said, the technology isn't always as efficient as it can be. So there's inevitably going to be children that fall through the net or content that falls through the net. But secondly, they only have to do a risk assessment on their site. So if child harm or child sexual abuse material is reported, then they are basically asked to do a risk assessment of their site. But who's helping the child? Who's trying to stop this happening on the ground? It won't be effective in any way other than to take material out when it's detected. And of course, the big issue around the Online Safety Act was around encryption and how do tech providers actually manage to screen encrypted sites. And that just, there is no solution to that problem because they cannot do that. And if they do, then it prejudices the privacy and the effectiveness of encryption. And that's something we all depend on for things like banking, for things like, you know, any kind of confidential service, and also to have private chat, which children themselves, as you'll see in a bit, also value. Next slide. So our project was aimed at doing something about this on the ground in a community. We thought we'd take a place-based approach and pilot it in one community to analyse how online child sexual victimisation is currently understood and responded to by police, public, third sector partners, parents and children, and then to work out how police can best work in partnership with others to respond to and prevent online child sexual victimisation. Now, at the moment, this tends to be a technical issue that is dealt with by special units. But the issue is, how do we get something on the ground to work more proactively and effectively to prevent online child sexual victimisation from occurring in the first place? And we came up with the idea of producing a locality-based quality standards tool that could be applied nationally or outside. So this is a pilot with the scope to develop either nationally or internationally, because it could work anywhere. The model is something that could be built up and adapted to the local environment. Next slide. So quality standards are a health, because of course the public, within a public health framing, quality standards are a way in which responses can be measured. They become measurable. If we have a standard, then we know how well we're doing in terms of dealing with that threat. NICE, the National Institute of Clinical Excellence, Social Care and Clinical Excellence, basically sets this framework, and it's very popular and has been used in health for a long time. It's more taken up more in social care now, and certainly within policing, it's a framework that has a lot of potential. The thing about quality standards is that they have to be owned, they have to be evidence-based, in other words, or evidence-informed. So we have to have evidence before they're issued, and then they have to be owned by whoever is responsible for implementing them. Otherwise, they just sit in a box somewhere. So the whole point about our approach is to take a co-design, co-production approach and to go with the community in terms of how they want to develop a response and which quality standards they think are important in order then to integrate them into practices and responses in the area. Next slide. Christine.
Great. So I'm just going to give a brief overview of what our project actually entailed. So as you can see on the screen, there are a number of steps involved in our project. We initially started with a RAPL appraisal of the community we were working within. This involved going in and just starting to meet people that are working in this area. That included practitioners, police, community organizations, and people from health. And once we had completed our kind of RAPL appraisal and got an understanding of how things operated, we then started to conduct focus groups with these same people, but then also including parents and young people and educators. And I'll talk a bit more about how we did that a bit later on. We also, alongside that, were conducting a case file analysis of police files related to internet child exploitation cases, and Larissa's going to talk in a bit more detail about that. All of this led up to our co-production or development phase, which was a visioning day, which occurred last November, and was a day where we brought all of these people together to discuss these quality guidelines. And again, we'll go in more detail about this a bit later. And then this resulted in the development of some working quality standards that we're currently still working on and are looking forward with. So that's just a quick overview of kind of all the different stages involved in the project. So if we move on to prevention. So in this risk rapid appraisal, some of the main findings we had in terms of risk factors when speaking to people such as educators, practitioners, parents, all relate to these kind of 5 general risk factors. This isn't new information. This is, I think, well known in this field, but these were ones that were presented to us by the community specifically. And as this was a place-based approach, we wanted to highlight them. So this includes access to the online world, online accounts, these types of things, but also then the platforms that host that, including chat rooms, but also then the environment, including the environment in which the child or the young person is living within, but then also individual needs, especially if they're neurodivergent or they had learning disabilities of any type. And that all ties in as well to kind of developmental risk factors. So as you can see, we've kind of split these into traditionally kind of online and offline issues, but they really operate all in the same realm. So even though some are specifically online, like access, if you consider the risk factors of access with individual needs, which are considered typically offline needs, we can look at this kind of more holistically and realize that though this might seem like a purely online issue, it also can be seen in the offline world as well. So in our rapid appraisal and our focus groups, we were gathering kind of adults and community workers' perceptions around these issues. And this quote in particular really highlights some of the main issues. And this is a quote from a lead of a local youth organization that we worked with. So the quote is, "The world has changed. We haven't caught up with how to best support children in that space. We have one-to-one conversations, but are we doing enough? Probably not. Are parents able to keep up with it? Absolutely not. I don't know what the answer is, and we've tried classroom type group deliveries, and the older ones especially are like, oh, we've done this, we know it. They don't understand their own vulnerability within those spaces. But equally, we don't want them to feel vulnerable in those spaces. So it's a really tough one. And this just kind of highlights the fact that people are trying to deal with this issue. But for example, this community worker was saying, the children are indicating that they've also received this training and talked about these issues in school. So they feel like they might have the answers, but then in terms of practical application, there's a bit of a disconnect. So then we also spent some time speaking with parents, and this also reflected some of the main points that we were hearing from parents. So on the top here, there's lack of knowledge and support, and this quote kind of indicates that. So this parent, the mother of 2 children, said, "If my daughter came up and said, oh, such and such has asked me to do this, or such, I'm doing this," I'd be like, what do I do? Who do I talk to? Because kids get taught it in school, but they don't ask parents to go in and say, do you know what will happen if they did this? Or do you need help with this? So this really reflected the parents. There's a lot of resources in terms of the national resources available for online safety, but a lot of parents weren't sure about local resources and what might happen in their local context. And then there's also parents were unsure as to how to proceed in terms of protecting their children. So that's what this bottom quote kind of indicates. So this was also another parent, a mother of 2 children. "My children don't go to other people's houses because I don't trust anybody. No, honestly, they don't go to next door, but one who very much parents like I do. I know their children and they don't have devices and things like that. I'm not saying it's bad for your child to have a device because one of my children does have a device, but I agree as well. I think anybody with a device from any age is at risk of seeing anything online." So it's also kind of reflected, parents were so unsure that this parent in this case decided just to eliminate that as a possible risk factor, or at least as much as she could. So these were just kind of some of the initial impressions we were getting from the community in response to what is a very complex issue. So now I'm going to pass over to Larissa to talk a bit about the case file analysis and some of the responses.
Thank you, Christine. Yeah, so I'll talk a little bit, moving on from kind of the prevention work and what we heard from local community members. We've also looked at what happens when something does happen and how do people respond to this. So part of this was our case file analysis. If you could move on a slide, please. So we conducted a case file analysis of police recorded cases of internet child exploitation. That was a category that has recently been introduced in this force, and it relates to 8 particular types of crime, which I will show you in a little while. So we looked at cases in this particular locality, so not regionally, but specifically for that particular area, that were recorded between the 1st of January in 2022 and the 31st of December 2022. So most of them have actually been completed. So the police aspect of those cases has been completed. So I'll show you some of the outcomes as well. We found 185 cases within that year that were recorded as ICE internet child exploitation cases where the victim was either blank, so it wasn't recorded, the age of the victim wasn't recorded, or 0 to 17 years old. 4 cases within the 185 were not actually ICE cases, so they were related to sexual communication with a child in public and in person. So there was no online aspect to that interaction. There were a lot of cases that mentioned different types of vulnerabilities, often in relation to anxiety. So actually the case notes stated, you know, this young person is quite anxious about firstly being in touch with the police around this issue, and also doesn't want to support any action being taken. So that was an issue that came up quite often, and then some of the risk factors that Christine talked about earlier as well. And then several children across the board were recorded as suspects. So within the victim blank category, there were more adults, and that was more around CSAM, child abuse material uploading and sharing. But where the victim was 0 to 17, it was often that the victim in that case was actually recorded as a suspect on the system. Move on a slide, please. So on this slide, you can see the 8 categories that this force has been recording as internet child exploitation cases, and you can see the differences between how many were recorded with a victim age blank and how many were recorded with a victim age between 0 to 17. So where the victim age was blank, like I said, it was often in relation to CSAM cases, but actually there were over 20 cases within the 66 cases that actually had an identified victim that was under the age of 18, and it wasn't appropriately recorded on the system. So that makes it difficult to identify the scope of this issue locally within those recorded cases. Additionally, we also did a dip sample of cases that were not recorded as ICE cases, which showed that there's other crime categories that have you know, some of these aggregating factors that you can see at the bottom there. So online crime, or that are cyber dependent, that are not within these 185 cases, which I think is something else that we might need to explore. And just to say that the second crime category, disclosed private sexual photographs, and the last one, threats to disclose, were categories that have more recently been introduced, that have often been absorbed in the blackmail category for our case sample, because it's a couple of years old, the cases that we were looking at. And also to say that we are still analyzing this data. This is just a brief overview. This is still ongoing, this work. Next slide, please. So if we look at the markers, as I said, there was quite a few that kind of looked at different types of vulnerability. Markers were mentioned in 33 cases of the 185. They were not consistently recorded, so I could identify markers like missing from home or autistic or adverse childhood experiences in other cases where it then wasn't mentioned in the marker category. But the most common for children, which are highlighted in purple here, were that children had autistic traits, were either diagnosed or the parents said that they were about to be diagnosed. They required an appropriate adult. They had a child in need plan in place or previously had one in place. They had adverse childhood experiences, ACEs, or had something like ADHD. The gray ones you can see here were those markers that both children and some of the adults who viewed or uploaded or shared CSAM had, and that included suicidal thoughts and self-harm, being a vulnerable person or a vulnerable child, and having learning disabilities. And then the blue ones or turquoise ones are the ones that were only recorded for adult suspects in this case, so being a sex offender and using drugs. At the bottom here, you can also see how often a vulnerable child risk assessment was conducted and also the outcome of these. So we had 33 high risk assessments, 38 medium, and 17 standard or considered lowest risk. So that was 88 cases out of the 185, even though there were many more identified child victims within those case files. And we're not yet sure what made the police to conduct one vulnerable child risk assessment in one case and not in another. So that's something that we're still exploring. Next slide, please. And then if we're looking at the outcomes, you don't have to look too close to that. I know that's quite small, but hopefully you can see the color coding. So just looking at the outcomes, it was interesting that a lot of cases ended in one form or another, no further action. So 20% of cases where the victim was blank ended in no further action, and 50% of cases where the victim age was 0 to 17 ended up in no further action. You can also see towards the bottom, there is a outcome measure that is called community resolution, words of advice. It said that there was 8 cases that received that outcome, but actually looking at the cases in a bit more detail, you could clearly see that that happened much more often. So in many of the case files, police stated that either they themselves or a safeguarding lead from school had talked to the parents or the child or both to give words of advice. Interestingly, we were not quite sure what those words of advice were. That's not specified, and it's also not specified where they got the information. So which kind of standard they used to give that advice and which information they used to give that advice. So moving on from the case file analysis in terms of responses to this problem locally. Next slide, please. We also talked to local practitioners about this, including police and also the local multi-agency safeguarding team. And one of the issues, and which I've kind of briefly mentioned at the start, was around anxiety when you report. So a lot of practitioners, and as well as children, as Christine will mention in a second, that there was a lot of anxiety around reporting, not knowing what will happen with that information, and local youth workers were quite aware of that. So you can see that in this quote, they don't trust the services above us. So that was a local youth club, and how they will deal with that information. And whatever the consequences might be, and that is out of their control, and that is also out of the control of the local youth worker. So they knew, they all had local safeguarding procedures. They knew that when something was brought to them in relation to online child sexual abuse or exploitation, they had to record that within their safeguarding procedures, and that will be shared with the multi-agency team, and they then decide what happens next. So that was often considered a problem for both youth workers locally and the children, because it was unclear what happens in one case might not happen in another. And anecdotally, people would hear different stories from different people of what might happen when they come forward. And that kind of doesn't necessarily strengthen the trust in local responses if the responses are different depending on different cases. Next slide, please. So overall, the challenges identified from kind of our work in focus groups and interviews locally was that there was inconsistencies in how cases are reported, recorded once they have been reported, and how they were handled locally. So some cases, I know I say lower level here, but what I mean by that is they're peer on peer, and they tended to be on the edge of, is this a problem for the police, or is this a problem for local practitioners, and sticking with words of advice of someone who wasn't clear, you know, that having a picture or a video or uploading it is actually against the law, for example. So particularly in those cases, practitioners and parents weren't really clear at what stage they would have to get in touch with the police, and at what stage what response would be necessary. There was significant underreporting, at least from the perception of practitioners locally. Adult responses versus young people's perceptions, as Christine mentioned earlier. There were questions around responsibility and support. So who should intervene, when, and why? A lack of clear guidance and support to identify and address online child sexual victimization early. So as we said, around prevention, and some insufficient feedback loops when local practitioners did report something. So when you raise something in your safeguarding processes in a school, or for example, in a youth club, then a lot of practitioners said, we don't hear back from it. We don't know what happened once we've reported it. So we don't know if the information we provided was okay. We don't know what the outcome was. And then we don't know how to support that child when they come back into our youth club, for example. So some issues around connecting the dots there. Next slide, please. Looking at the opportunities, we found some really, really good practice locally, generally speaking. So we found that there's a lot of local children and young people groups that inform local practice, not in particular for this problem, but generally. So there's local youth groups involved with the council, for example, and that places a good baseline for us to work with children, and that gave us opportunities to talk with children and young people. There's strong relationships with police and social work, which has enabled child and family-centered approaches from the multi-agency team. So the tertiary work that Corinne talked about earlier was quite strong locally, certainly for cases that were quite serious that made it to that multi-agency safeguarding team. There were strong youth provisions, so a lot of youth clubs, and there's a well-established and positive multi-agency team, as well as co-production teams, which helped us a lot with our co-production work, which Christine will talk about in a second. And I will now hand over to Christine, who will talk a little bit about the young people's and children's views.
Yeah, so one of the main issues around this topic is that a lot of time, because of the sensitive nature of this issue, young people aren't engaged with. And that's usually as a result of, you know, the ethics of dealing with young people. But also it is a tricky subject that it can be difficult to speak with young people about. We were very lucky in that we got to engage with some young people and young people group in the local area we were working with. So some of the main, you know, feedback we were getting from young people were centered around things like anxiety and fear of reporting. And that also was a result because of different responses from different adults in their life. So depending on who you reported it to, whether in school or to a parent, there might have different outcomes. But also the normalization of risky behavior. This was something that the young people themselves recognized, that this was normalized, and that they were seeing it become normalized with children even younger than themselves, particularly if they had younger siblings. Or even just within a school, they were noticing behaviors they themselves started at an older age being represented in children younger than them. The maturity and understanding of the risks also varied widely. This was also dependent upon the maturity of the child, but as I'm sure we all know, that can change wildly depending on the child. And a strong influence of peers, of friends and peers. So there's two quotes on the screen that kind of represent these views, but I think the one on the left here really represents a good, or has a good representation. The quote is, "I would never listen as a kid. The only way for you to learn is actually experiencing it yourself, and it's almost a thing you've got to learn the hard way to actually learn." So that was something that we also heard from educators, was that, you know, as much as these kids are learning and going through the online safety courses, learning it, experiencing it firsthand was the only way it really seemed to make an impact. I'm gonna skip the second quote here, but I think it's important. I hope you've had a chance to look at it. But I'm gonna move on to talk specifically about our co-production work with young people. So this was something we centered our co-production work around this question of, what do children think about this problem and what do they want to happen? So we were extremely lucky to be working alongside and with a local community group in the area we were working, and they allowed us to facilitate some workshops with children in that club. We brought in a local spoken word artist who came in and had a series of workshops with different age groups, including young children, ranged anywhere from between 7 to 11. I think the second group was like 11 to 13 or 14, and then 14 to 15 or 16. And so these three different groups had really good representation of the young people. The younger groups didn't deal with anything very serious. It was more like online safety talk, but the local spoken word artist was able to produce a script out of these different workshops that were words and things that the children had themselves had said. And from that, we were able to produce a short animated video, which we'll show you here in a second. Some of the limitations of this were that it was only included children who had attended these youth groups. So it didn't include children that might be excluded from school or these types of youth groups, and also had a limited lived experience of online child sexual victimization. So I'm going to go ahead and show you this short animation.
We spend
Sorry.
lots of our time on phones and laptops, TVs and iPads, connecting with mates on consoles. It's not a phase or one of those fads. Browsing YouTube, playing Roblox, streaks on Snapchat, watching TikToks. It's part of our lives. To blend virtual with reality. We know there's lots to learn, and it's often without clarity. On the one hand, we get to chat to family and friends, to those we see often and those hardly ever. A message is the same, in an instant it sends. We get to harness our passions and skills on Minecraft, Fortnite or FIFA for thrills. We use it for schoolwork and to learn, or to distract our minds when we've time to burn. On the other hand, it can be a dangerous place. We get tired of random friend requests or inappropriate messages from profiles without a face. Scam bots looking to hack. Strangers having this knack of popping up in places where self-esteem there is a lack. Sometimes no filter or protection from what content we consume. Swearing, nudity and bullying can unexpectedly enter the room. Sometimes it's a personal attack where private images are shared. Friend fallouts seek ruthless revenge, and we quickly become scared. We know how to report these kinds of things. Some of us use the in-app facility, speak to parents, carers, trusted adults, or the police if we've the ability. But not all of us take this step, often wondering what's the point, worrying about causing a fuss and who we might disappoint. There are things that are helping, creating a better understanding of being online. But there's so much more that could be done to make sure we're safe and fine. The apps need to do better. Age restrictions must be enforced. People should need to identify themselves. That's an idea we endorse. Having more opportunities in PSHE, and for it to begin sooner, perhaps in year 3, When conversations are the norm, talking becomes fluid and free. Even pupils could help with the content and delivery. And similarly, with the police, stepping out of uniform for a few seconds. Come to us and talk it through. Help us connect as danger beckons. More could be done to trace and reprimand. We know this part is difficult, so help us understand. It's nice when parents and carers are calm and interested in what's going on. There are ways to track and discuss without our privacy being gone. We're on this journey together, learning what and what not to do. You can learn as much from us as we can learn from you.
That animation, and as you could hear at the end of that, that was recorded with some of the kids from the local group that we were working with. And I think some of the main takeaways from this was that a lot of the kids were saying that they would like to be involved in helping develop the curriculum and maybe even deliver it, especially to younger children. This was really important to them. In making that animation, a number of children were brought to look at the storyboard and kind of correct things that they didn't think were right and stuff. So that was a really great way of pulling in young people and getting their voice heard on this project. And we were able to show this project at our visioning day, which these are some images from the visioning day. So as I think I mentioned previously, this was a day we had last November where we brought together people from police, social work, health, education, parents, and then we did have a couple older young people there, but we also showed that animation as a way to bring in the younger children's voice and help make sure that their voice was heard, even though this was during the day and they couldn't attend. And so the visioning day centered around these kind of 3 questions. So what does a good response to OCSV look like in this community? What should the priorities of such a response be? And what can you do to implement these priorities? So we spent a large part of the morning kind of trying to develop these priorities. These are things that we discussed a little bit with people during focus groups and interviews, but then went on to create a full list. And then in the afternoon, we placed all of these priorities up on a live app that people could live vote on. And so people were able to, in the room, rank these. And these were the 11 priorities that the community came up with. I'm only going to mention the top 3 here. So the first one was a coordinated multi-agency approach. Second one was listening to young people and including child-led initiatives. And then also 3, education and awareness for all. So if you look at all of these 11 priorities, there's a lot of overlap between them and a lot of crossover. But this was important to see, as we're co-producing this alongside the communities, these were their priorities. So out of this, we were then able to, alongside a working group, kind of narrow and focus those 11 priorities down to these 6 quality statements. So these aren't kind of ranked, we just have them listed, but they're all of equal importance. But the first one is prioritizing a multi-agency responses. Number 2 is child and young people-led responses. Number 3, consistent and evidence-based messaging. Number 4, consistent recording and monitoring systems. Number 5 is public awareness about impact and responses. And number 6 is support interventions. So these represent our working quality statements that Corinne was mentioning at the beginning, that we are hoping to implement in communities, and we have started to implement in this local context that we're working with. But Corinne is going to talk a little bit more about how we're moving those forward. Oh, you're still on mute, Corinne.
Integrate the quality standards into existing frameworks and continue to work with this local community. It was a pilot study, and we're looking at the approach and priorities in a different locality to see how they might need adjusting or developing. We're evaluating the quality standards and their potential, and develop and adjust based on the evidence that we find in different areas. And taking them forward. So I won't dwell on this because we're running out of time, and I want to leave a little bit of time for some questions. We got the next slide. Questions. Over to you, Adam.
Okay, great. Thanks a lot. Listen, that was a very rich and multi-layered study and multi-layered presentation. So we've got a bit of time. Do put questions in the Q&A function if you have them. I know that Larissa's already answered one particular question in terms of the detail. Just while we're doing that, just to say that tomorrow, the ESRC, the Vulnerability and Policing Futures Research Centre, along with Child of the North and the Centre for Young Lives, will be publishing a report entitled An Evidence-Based Plan for Addressing Childhood Vulnerability, Crime and Justice. And the work of this research will be showcased there, as will some of the work of some of the partners that the team have been mentioning. So do look out for that. That's going to be hosted on the N8 Research Partnership website. So that's the best place to get hold of that. So listen, one question that's coming in is, I suppose it goes to a point that I think, Corinne, you mentioned earlier, which was about the quality standards, potentially the danger of them being tick boxes. So is there anything or any evidence from the pilot as for how the kind of implementation is ensured that doesn't take place, that these are lived and implemented quality standards? Any comment you might have on that?
Indeed. So that's a really good point. And I would hate for this project to be all about we were developing quality standards and that's the outcome. The whole thing about the project is the process. It's about bringing the community with you and looking at how these quality standards can be integrated. So they're picking up on their concerns, they're reflecting those concerns, and then there's a will, there's a motivation to then pick up on the quality standards that relate to those concerns. That's the first thing. The second thing is looking at how they might be applied. And of course, the quality standards, the whole point about quality is they're measurable and they're accountable. So the sort of discussions we're having at the moment within these multi-agency arrangements and in the area are about, well, how can we put in some indicators and measures in order to take these forward, so we know that they're not just a tick box, but that they actually are making a difference on the ground. And there are things like, for example, we've already said there's a lot of co-production, there's a lot of child participation in this area, which is great. Are there things that can be, are those the foundations for offering opportunities to see whether, for example, responses are being child-led? Have things changed within schools? Can children run their own survey, for example, once a year, annually? I think one of the areas that we really want to take forward in the demonstration project, which I just mentioned at the end there, where we're going forward to in other areas, is how can we better involve businesses in some of this? Because if there's obviously a lot of this needs additional, not all of it, but some of it needs additional funding, and particularly the participation element. So are there ways of resourcing this that are about, you know, sort of community partnerships around this issue, and children, you know, use internet facilities across the area? There's lots of places children go and spend their money and get involved, and can these businesses be a bit more active in terms of their contribution to this issue? That's something we're exploring. So it's all about how do we put these into existing mechanisms, develop existing mechanisms, and continue the practices. And that was the issue about ownership that I mentioned very early on about in terms of developing the quality standards. They have to be owned. They're not ours. They're this local authorities.
So just a question from me then, Corinne, just to follow up on that a little bit, which is about, I suppose, because you mentioned the private sector, which is interesting, the role of businesses. And there's obviously some big public sector organisations, the police, safeguarding, etc., local authority. but you also seem to touch on the importance of the voluntary sector, and presumably that is quite patchy across different places, and so maybe just some reflection on the crucial role that the third sector organisations play, and some of them are very local, which is one of their strengths. But of course, when you're thinking about, you know, not having postcode kind of lottery in this field, how you overcome some of those challenges.
Yeah, I mean, it's a really good issue. I mean, well, to point out that it is sadly the case that in many areas they don't have the same facilities as this area had. And we were highly dependent on the voluntary sector in making this project a reality. They definitely had their ear on the ground. They definitely were connected into different parts of the community, and they had very good processes for engaging with children and young people. So they were a voice and have continued to be a voice in everything we've done. But how do you make up for their absence in areas where those facilities are not around? I mean, in all areas, there is something on which to build, I think, roughly. But yeah, it's patchy. It's not everywhere. And certainly we were very fortunate in the quality of these youth services in this area. They were absolutely amazing, quite frankly. And I don't know how I mean, it's just about pressing for more of that, I guess, but I don't know the answer to that really, Adam. It's a good question. I don't know if Christine want to say anything there.
I think there's something around they do a lot of work in upskilling, not just the key statutory partners, but also the voluntary sector. So everybody gets the same contextual safeguarding training, for example, so that they get to the same page, but there's still some more work to do around consistency in how things are responded to. So I guess if there's a local authority that thinks about these standards and having a certain threshold, not just in relation to when to report something, but also how to report something and how it's recorded, and that needs to include the voluntary sector, because otherwise we don't know what the nature and the scope of the problem is, and that has been a real challenge to see. I mean, we're still trying to figure out what the real scope is, even in that one community which already has so much in place. So I think there's a lot of importance to put on getting the standards right across the whole local authority, including all partners, and that includes skilling up voluntary sector in the same training that everybody else has within the local authority.
Yeah, and I'll just, on the end of that, I'll also just say, and that's why I think it's like having a local context is so important, because what we realized was that there were a lot of resources even within these different organizations, but if we could central and streamline that message so it was the same across all of those voluntary organizations, because it might be the case that maybe it's more religious organizations in different communities, but getting a better understanding of what's available in that community. So you're not having to make something new. You can just use what's existing and work in that framework. And that's what the quality standards kind of highlights.
Okay, I'm conscious of time. Just a final question. So which is, how do people find out more? So about the work that's going. There's obviously the summary findings, which is available via the centre's website. Could you say anything else about how people get hold of further information? Are the slides going to be made available?
Yeah, the slides can be made available, absolutely. We've also, as one does, written an article which hopefully will be published shortly, although these things take time. But yeah, there will be an article based on the project which will explain more about the methodology. And we're all open to, being approached. If someone has questions, they want to contact me, that's fine. I'm quite happy to say more about the project if that's helpful.
I will say the animation video is also available on the website that's listed there, if you wanted to share that or have a look at it again.
Great. Listen, thank you very much to the team, and thank you to the audience. Have a good rest of the day. And do look out for our forthcoming webinars in the future. Bye.
Thank you, everyone.
Thanks very much.
Thank you.